Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wondered what herpes genitalia is all about? It's a common sexually transmitted disease that affects millions globally, leading to significant impacts on sexual and reproductive health. Originating from the herpes simplex virus, this disease can manifest in various forms and severity. It's primarily transmitted through sexual contact, but other forms of transmission are also possible. Knowledge is power, and understanding the cause and symptoms of herpes genitalia can help in its prevention and treatment. What causes herpes genitalia? Well, let's dive in. Herpes genitalia, often referred to as genital herpes, is primarily caused by two types of viruses: herpes simplex virus type 1, or HSV1, and type 2, or HSV2. HSV1 is typically associated with oral herpes, but it can also cause genital herpes through oral genital contact. On the other hand, HSV2 is more commonly linked with genital infections. Transmission of these viruses often occurs through sexual contact, including vaginal, anal, and oral sex. It's not just limited to intercourse, though. Herpes can be spread through any skin-to-skin contact with infected areas. So it's possible to contract the virus even if your partner doesn't have visible sores or any other apparent symptoms. Moreover, it's worth noting that once you're infected, the virus stays in your body lying dormant and can reactivate several times a year. It's important to note that herpes genitalia can be transmitted even without visible sores. Now, what are the signs and symptoms of herpes genitalia? Well, the symptoms can vary widely from person to person, and it's important to note that some people may not experience any symptoms at all. However, the most common signs include blisters or sores in the genital area, often accompanied by pain or itching. These blisters might burst to become ulcers, which can be quite uncomfortable. Another sign can be pain during urination, which is caused by the urine flowing over these sores. Some people may also experience systemic symptoms. These can include things like fever, body aches, swollen lymph nodes, and even headaches. It's also important to know that the first outbreak is usually the most severe, and subsequent outbreaks tend to be less severe. This is a tricky virus as it's not always symptomatic, so if you suspect you've been exposed, it's best to get tested. Remember, even without symptoms, the virus can still be spread to others. So, how do medical professionals diagnose and treat herpes genitalia, you may wonder? Diagnosis often begins with a physical examination, where healthcare providers look for herpes sores in the genital area. However, since signs can be mild or even absent, additional lab tests are usually necessary. These tests may involve a swab from a sore for virus culture or a blood test to detect antibodies. Once a diagnosis is confirmed, treatment focuses on managing symptoms, as there's currently no cure for herpes genitalia. Antiviral medications are the common line of treatment. These drugs, which include acyclovir, famciclovir, and valacyclovir, work by slowing the growth and spread of the herpes virus in the body. But it's important to remember that these medications are not a one-size-fits-all solution. They're typically used to reduce the severity and frequency of outbreaks, not to eliminate the virus. Some people with frequent outbreaks may need to take these medications daily, while others might only need them when symptoms appear. In addition to medication, supportive care is also crucial. This can include pain relief measures, keeping the affected area clean and dry, and avoiding tight clothing that can irritate the sores. Remember, every individual's experience with herpes genitalia is unique, and treatment should be tailored to their specific needs and circumstances. So, while treatment can help manage the symptoms, it's also important to maintain open communication with healthcare providers to ensure the best possible outcome. While there's no cure for herpes genitalia, treatment can help manage symptoms. Finally, how can you prevent the spread of herpes genitalia? Prevention is key, and it starts with responsible sexual practices. Using barrier methods like condoms and dental dams during sexual encounters can significantly reduce the risk of transmission. It's also essential to have regular screenings for sexually transmitted diseases even if you don't have any symptoms. Open communication with your partners about your sexual health status is another crucial step towards prevention. Don't shy away from these conversations. They're essential for protecting both your health and the health of your partners. Antiviral medications can also play a significant role in prevention. If you have herpes genitalia, these medications can lower the risk of you transmitting the virus to your partners. Remember, Herpes genitalia can spread even when you don't have visible sores, so never let your guard down. Prevention is always better than cure, especially when it comes to sexually transmitted diseases like herpes genitalia. UMCC, your ultimate medical consultant connectors.